Hi, everyone. I'm Marina Kurian, and I'm on the IFSO Communications Committee, and it is my pleasure to interview Dr. Maurizio De Luca for our July 8th Journal Club, which will start at 2 p.m. Central European Time. And Dr. Maurizio De Luca is the director of the Department of Surgery at Rovigo Hospital in Italy. He's also the vice president of the Italian Society of Bariatric Metabolic Surgery and treasurer of IFSO EC. More importantly, he is the author of the IFSO position statement on OAGB, and so I would like to welcome him to this webinar.
Thank you. Thank you, Marina, for your kind presentation. It's my pleasure and my honor to be here and to be presented by you.
Okay, so just as a teaser for the actual webinar, I want to ask two brief questions to you. One, in the position statement, we're going to talk about the importance of using one term for the one anastomosis gastric bypass. Can we just discuss that briefly?
Yes, thank you. This is a big question. First of all, I want to say that this updated IFSO position statement was issued mainly in response to the inquiry of the IFSO by society members, universities, hospitals, physicians, insurance, etc. And this is one of the main items that we had. Of course, we know we have two different kinds of operation. The first operation is MGB, mini gastric bypass, from 1997, Robert Radlage, with a gastrojejunal anastomosis, terminolateral anastomosis, and 180 to 220 centimeter biliopancreatic limb from the triads. While the second operation is the OAGB, one anastomosis gastric bypass by Carbaco and Caballero, or BAGUA, which is a gastrojejunal anastomosis, lateral in this second case, which is at the beginning of the operation, 350 centimeter biliopancreatic limb from the triads. But both the operation are a gastric bypass, and both the operation are a gastrojejunal anastomosis with one anastomosis. So in the opinion of the IFSO OAGB task force, it's useful to have only one word, only one name to mean this very big group of operation with one anastomosis.
Yes, thank you. And so we're going to expound upon that even more once on July 8th. And then the other question I want to ask is just a real yes or no question that you will answer in depth next time we meet on July 8th, is if the OAGB should have a standing next to gastric bypass, and if that is something that you think should happen. Since the gastric bypass is our gold standard, do you think that the OAGB is a strong enough operation to stand next to it?
Okay, this is a very big issue, which many bariatric surgery in the world feel, of course. I want to specify that this is a very huge systematic review where we started with 5,259 papers, and at the end of our systematic review selected 110 studies. From these, 15 studies were from a qualitative analysis and 95 studies were for quantitative analysis. And between them, 81 studies were comparative studies, 18 comparative studies with Roux-en-Y gastric bypass. At the end, what about our recommendation? Our recommendation regarding this item is that the outcomes from OAGB to date are promising in terms of short-term operative time, low operative complication, good weight loss, and good comorbidity remission compared with Roux-en-Y gastric bypass. If I have to say the big bias of this operation, in my perception, is the malabsorption for two reasons. First of all, different surgeons practice this operation in a different manner. It is not a real MGB, it is not a real OAGB, but a mixed procedure. And consequently, they write in a different manner. So it's very difficult for us to interpret their data. Second, the term malnutrition is misinterpreted. For some surgeons, is only hypovitaminosis. For other surgeons, is only hypoalbuminemia, etc. So the debate item regarding OAGB and Roux-en-Y gastric bypass, in my perception, is the problem of malabsorption.
Okay, so maybe. I think your answer was not yes or no, but it was maybe. Well, anyway, thank you so much. We are going to hear so much about OAGB and really understand the IFSO position statement. Again, our journal club will be July 8th at 2 p.m. Central European Time. Dr. Maurizio De Luca is going to be there. I'm Dr. Marina Kurian, and I look forward to seeing you all on that day.
Thank you, Marina. See you on 8th of July.
Ciao.